Hello, my name is Luana. Welcome to my LifePage, and today we'll talk about psychiatry. Before we do that, let me give you a brief introduction about myself. I went to a private Catholic school, and I was a very good student. I always liked studying and reading, and I used to see my masters and as gurus, and I always thought they had something to teach me. And as a child, I already thought that I could become a doctor someday. So as a student in high school, I prepared myself to do the big test and get in a university. So when I was 19, I got to medical school called FAMEMA. Psychiatry is part of medicine, so you have to become a doctor to be a psychiatrist, and is the field who takes care of mental disorders and how people relate to each other and to themselves into the world. So we take care of people and any difficulty that they might have on taking their lives. One of the important things is mental health disorders like depression, anxiety, psychosis, drug abuse, and dementias. And you need to know about all this because as a doctor, that's what you're going to treat. We also study mental health procedures, the way we can treat the patients. One important one is empathy. You have to be able to put yourself in the other one's shoes and see life through his eyes. As a psychiatrist, you have to be a very good listener. You have to be able to listen deeply to the patient's problem and the things that he's going through, so you can think together the best way to get out of that problem. And the first one is that you can take care of people. They come to you and they relate deeply because they talk about their problems and the way they feel in life and the way they relate to the beloved ones for them. And nowadays, people still find difficult to look for a psychiatrist, even though they're not feeling well, because they have prejudice about what they're feeling and about what kind of treatment they would receive. I wake up early in the morning, I do my yoga and my meditation practice, and then I go to the hospital. I work in an emergency room as a psychiatrist, and that's a place where I can see the crisis and psychopathology posing in front of me and treat people when they really, really need. Afterwards, I go to my private office where I have consultants that are scheduled with patients. Some of them come weekly, some of them come every 15 days or every month. It depends on each case. And I work till 8, maybe 9 at night. And then it is a tiring day, but very satisfying also. And when I get back home, sometimes I still have to study and I have to write some articles and get some things ready for the next day to start again. I'm also a psychiatrist teacher for medical students, and I hope I have been able to give you a real balance of what psychiatry is. Thank you.